Hey students, this is Dr. Gonzalez. I hope you're having a good day when you're watching this video, or a good night if you're watching it overnight. Let's just go ahead and get started with the following topics. Here we can see the pulmonary trunk. This structure carries poorly oxygenated blood from the right ventricle into the lungs, and it begins at the pulmonary orifice of the right ventricle, and it runs superiorly, posteriorly, and to the left. This structure ends inferior to the aortic arch by dividing into a right and left pulmonary arteries, and it is located in the middle mediastinum within the pericardial sac. Over here we can observe the right pulmonary artery that passes to the right, posterior to the ascending aorta and the superior vena cava towards the hilum of the right lung. And we can also observe the left pulmonary artery that passes to the left, anterior to the descending thoracic aorta towards the hilum of the left lung. In the thorax, we also have a couple of veins that are called the azygous venous system. The primary purpose is to drain blood from the thoracic and abdominal walls, and it also receives venous blood from some thoracic viscera, including the bronchi, esophagus, and the pericardium. This azygous venous system is important for collateral venous circulation if the superior vena cava or the inferior vena cava are obstructed in some way. The blood in the azygous system drains into the superior vena cava, and this consists of two longitudinal venous channels, one on each side of the vertebral column. The first channel on the right side is the azygous vein, which you can see here in light blue. And the channel on the left side consists of two structures. One is the hemiazygous vein, which is more inferiorly, and the other is the accessory hemiazygous vein, which is more superiorly. But sometimes they are referred to as the inferior and superior hemiazygous veins, and they both drain into the azygous vein, and then the azygous vein, remember, drains into the superior vena cava. As for the azygous vein, this one is formed by the union of the ascending lumbar and subcostal veins on the right side. It enters the thorax by passing through the aortic hiatus of the diaphragm, and it ascends in the posterior mediastinum along the right side of the vertebral column to the level of T4, and arches forward over the root of the right lung and terminates in the superior vena cava. The hemiazygous vein, it's formed by the union of the ascending lumbar and subcostal veins on this left side, and it enters the thorax through the left crus of the diaphragm. It also ascends on the left side of the lower thoracic spine to approximately the levels of T9, and it crosses to the right side to the vertebral column to end in the azygous vein. Now, the accessory hemiazygous vein descends on the left side of the mid-thoracic spine to approximately the levels of T8, and it crosses to the right anterior part of the vertebral column to drain into the azygous vein as well. Next is the phrenic nerve. This structure that you see there in yellow, it's a branch of the cervical plexus that contains fibers from the ventral ramize of C3, C4, and C5. We're going to start with the right phrenic nerve, which you can see right here. This one descends along the right side of the right brachiocephalic vein and the superior vena cava. It passes anterior to the root of the right lung between the pericardial sac and the mediastinal pleura, and it reaches the diaphragm on the right side of the inferior vena cava. This one supplies the central part of the peritoneum. Now, on the left side, we got the left phrenic nerve. This one crosses the left side of the aortic arch, and it passes anterior to the root of the left lung between the pericardial sac and the mediastinal pleura, and it then reaches the diaphragm close to the apex of the heart. This one supplies the central part of the peritoneum, and these phrenic nerves typically are going to be accompanied by the pericardiophrenic vessels. The innervation of the phrenic nerves typically is motor fibers for the diaphragm, which is a respiration muscle. And it also has sensory fibers for a pericardium, the mediastinal pleura, and the central part of the diaphragmic pleura, the central part of the peritoneum. And pain caused by irritation of structures receiving sensory nerve supply from the phrenic nerve is referred to the shoulder region. Now let's go over the vagus nerve. There's two of them. There's a right vagus nerve and a left. The right vagus nerve is this one in yellow you can see over here. It enters the superior mediastinum and it lies between the right brachiocephalic vein and brachiocephalic trunk, and it descends lateral to the trachea and medial to the arch of the azygos vein. It then passes posterior to the root of the lung and it gives branches to the pulmonary plexuses. It also takes part into the esophageal plexus. As for the left vagus nerve, this one enters the superior mediastinum between the left common carotid and the left subclavian arteries. It then goes posterior to the left brachiocephalic vein and it crosses the left surface of the aortic arch. It passes posterior to the root of the left lung and it gives branches to the pulmonary plexuses, and it also takes part in the esophageal plexus. These vagus nerves are close to the diaphragm and they form the esophageal plexus, as I said before, but these plexuses forms two trunks that will then pass through the esophageal hiatus of the diaphragm together with the esophagus to enter the area of the abdomen. Now, some of the branches of the vagus nerve, it's going to include the left recurrent laryngeal nerve and the right recurrent laryngeal nerve. We're going to start first with the left recurrent laryngeal nerve, which originates from the left vagus nerve as it crosses on the left side of the aortic arch. It then passes inferior to the aortic arch and posterior to the ligamentum arteriosum. It then ascends towards the larynx in the groove between the trachea and the esophagus, and it supplies motor and sensory innervation to the larynx, specifically to the laryngeal muscles on the left side. And if there's a lesion, this can cause paralysis of the left vocal cord, which results in hoarseness. Now on the right side, we also got the right recurrent laryngeal nerve, which is this one in green right here. This one originates from the right vagus nerve in the root of the neck, and it curves around on the inferior aspect of the right subclavian artery, and it ascends to the larynx. Another structure of the mediastinum is a lymphatic structure called the thoracic duct. This structure is the largest lymphatic channel of the body, and it begins in the upper part of the posterior abdominal wall. Sometimes begins as a dilated sac that we call cisterna chyli, but more often by direct confluence of the right and left lumbar lymph trunks and intestinal lymph trunk, which collects the lymph from the lower limbs, pelvis, and abdomen. The thoracic duct passes through the aortic hiatus of the diaphragm. It then ascends in the posterior mediastinum, posterior to the esophagus, with the azygos vein to its right and descending thoracic aorta to its left at approximately the level of T5. It inclines to the left and ascends along the left side of the esophagus to the superior thoracic aperture. In the root of the neck, it arches to the left, posterior to the left carotid sheath, as you can see right there, and it terminates at the union of the left subclavian and left internal jugular veins. Another structure, similarly, it's the right lymphatic duct. This is a very small structure or a short vessel that is formed by the right jugular, right subclavian, and right bronchomediastinal lymph trunks, which terminates at the union of the right subclavian and right internal jugular veins, and it drains this lymph from the right side of the thorax, right side of the head, and neck and right upper limb. Another structure we find in the mediastinum is the thoracic sympathetic trunk. This usually consists of 11 or 12 ganglia connected to each other from a continuous chain. Therefore, we call it the sympathetic chain or sympathetic trunks. There is one trunk on each side of the thoracic vertebral column. In the superior mediastinum, the sympathetic trunk lies anterior to the neck of the ribs, and as it descends, it becomes progressively more medial until it lies on the lateral aspect of the bodies of the lower thoracic vertebrae. In this example right here, you can see how it descends on the lateral aspect of the bodies of the lower thoracic vertebrae. And throughout its course, it is covered by the parietal pleura. In this right lateral view, we can observe again that sympathetic trunk. And in here, there's going to be 3 thoracic splachnic nerves. There's a greater, lesser, and lowest or least splachnic nerves. These are going to originate from the lower part of the thoracic sympathetic trunk, typically the 5th ganglion and below. And they're going to pierce the corresponding crus of the diaphragm and terminate in the prevertebral ganglia in the abdomen, containing preganglionic, sympathetic, and visceral sensory fibers. So one nerve that we can observe here is actually the greater splachnic nerve. This is the greater splachnic nerve. And this nerve usually originates from the 5th to the 9th or from the 5th to the 10th ganglia. There's also going to be a lesser splachnic nerve that typically originates from the 9th and 10th ganglia, and the lowest or least splachnic nerve that originates from the 12th ganglion, which is lower. And these nerves, they have visceral sensory fibers contained in these branches, and they carry pain sensation from the thoracic and abdominal organs. Lastly, another structure we're going to see on the area of the mediastinum is the esophagus. However, we will not discuss this in this particular phase. We're going to discuss it again in the next phase. And if you want to learn more about this information, check out this video that we have tagged over here. And that's it for today. I hope you have enjoyed, and I'll see you on the next one.